Good evening, viewers, and I hope we are doing well and keeping safe from the coronavirus. We thank God for keeping us alive. Our topic for today is menstruation, and for convenience, we have divided into parts 1 to 4. Part 1, we will be talking on normal menstruation and signs of menstruation. For part 2, we'll be talking on irregular menstruation and pain or painful menstruation. For part 3, we'll be talking on scanty menstruation and heavy menstruation. That is scanty bleeding and heavy bleeding. In the last part, we'll be talking on no menstruation at all, that is absence of menstruation, which in medical parlance we call amenorrhea. So I start with by welcoming you and to tell you that the objective of doing this is to provide information on what a normal menstruation is, and so that you can recognize it and also have the idea of what to expect when your menstruation is approaching. We will start by talking about some parameters or some words, the key words that are related to menstruation, which we must know in order to understand what we are going to discuss. The first one is that menstruation, the way it is used means the blood that comes out during at the end of every cycle in a woman. That is the menstrual efflux. And aside from this, another key word is the flow. The flow means the amount of blood or efflux, which means that it may be heavy, it may be normal, it may be low. So flow denotes the quantity of blood that comes out. And of course the duration, that is, it comes out in a certain quantity for a certain number of days. Then we need to also talk about cycle and the cycle length. A cycle length is the day, is the interval between two consecutive menstruations. That is, from the first day of one menstruation to the beginning of the first day of the next menstruation. I will quickly want to talk about how to count menstruation, how to count the cycle length. The first day that you see blood, that blood comes out of you, is counted as day 1. I have had, in my experience, when we ask this question, when was your last menstrual period? Some women will tell you, well, I had the feeling that it came out yesterday or 2 days ago, but I actually saw it today. Now, the feelings should not be counted. The period that you felt it should not be counted. It is the first day that you saw it, that the blood comes out, that is counted as day 1. The second day is day 2. The third day is day 3. And then you count like that until another cycle begins. So if I say, for example, come and see me on day 21 of your cycle, I mean counting from day 1. When you get to day 21, that is the day you should see me. All right, so I should say that aside from that, we should realize that there are certain requirements for a woman to menstruate. The first is that there are some parts in the brain, namely the hypothalamus and the pituitary gland. These are parts that are very important in bringing about menstruation. Those two parts are very key because the first one is like a command center and releases some releasing hormones that influence the important hormones, two of them which we'll be talking about later, that will, in turn, this will stimulate the ovaries and then stimulate the eggs in the ovaries to produce hormones. And then lastly, the hormones will work on the womb to prepare the womb, and then if menstruation does not happen, if pregnancy does not happen, then menstruation will take place. Let me quickly go through the components of a normal cycle. So a cycle length comprises 4 components. The first is menstruation itself, which is the bleeding period when the woman bleeds. The second is the first half of the cycle, where when the body of the woman, especially the ovaries, are being prepared to produce eggs. And then the eggs get mature, and one of them, rarely 2, one of them, which is the dominant, called the dominant follicle or the right follicle, will then be extruded or be released. This is called ovulation. Now, after this, the womb will be prepared to accept the fertilized egg, and then pregnancy. Once the egg is fertilized, pregnancy takes place. That is, the embryo attaches to the woman. Then pregnancy takes place. But if it fails to, if fertilization, for example, the woman, if pregnancy does not take place, then the woman begins to prepare for another menstruation. So you can say that menstruation is like a failure. It's a sign that the womb has not achieved pregnancy for that month. I should say here that the whole purpose of the womb in a woman is to carry pregnancy. And each time it fails to carry pregnancy in a cycle, that is, pregnancy does not happen, then the womb starts to weep as if it is regretting that this month I have not achieved pregnancy again. I'm not happy. Then the womb weeps. And then this is akin to the womb bleeding. So like I said, the whole essence of the womb in a woman is to achieve pregnancy. And the whole essence of the cycle is to also be able to produce eggs that will be fertilized, and the embryo would attach, and then pregnancy will take place. If all this fails, then menstruation takes place. Therefore, like I said, remember I said there are 4 components. The hypothalamus must be functioning well, the pituitary gland must be functioning well, and the two of them must work together to ensure a coordinated function. The ovaries must be responsive to the hormones that of the pituitary in such a way that the eggs are matured and one will be released at the end of the day. This one that is released will be the one that will be fertilized, and then eventually embryo is formed, and this embryo will mature and then attach to the woman, and pregnancy takes place. This is the whole essence of the cyclical events in a woman. And if pregnancy does not take place, like I said, then the womb begins to weep. So we have to realize that. So what is the, how does it happen? How does menstruation happen? The first is that, like I said, the hypothalamus, which is very sensitive to stress, emotions, drugs, chemicals, environment, and all that, is the commanding center. It releases releasing factors that is that will tell the pituitary gland to release the hormones that will stimulate eggs in the ovary or in the ovaries. And these hormones are the luteinizing hormone and the follicle stimulating hormone. And especially the follicle stimulating hormone, or FSH, is very important in ensuring that the eggs in the ovaries, one on both sides, the eggs in the ovaries are matured, recruit some eggs in the ovaries up to about 15, 20, and then in the first few days of the cycle, that is when you begin your cycles, they recruit the hormones, ensures that eggs are recruited, and then the eggs begin to grow, and with time, one of those eggs would acquire more ability to grow more than the rest, and then it becomes the leading female egg. Once that is chosen, once the female egg is chosen, it now suppresses the growth of other eggs that were recruited at the same cycle, and then it becomes the dominant follicle, which is the female egg that will be fertilized during fertilization. And after fertilization, the zygote is formed, that is the union of the female and the male egg becomes the zygote, and then embryos begin to grow. And when they get to a stage where the cells have divided up to about between 200 to 240, 250 cells, then they begin to attach. At that stage, we say they are blastocysts, and then they are attached to the womb of the woman. So let us examine the womb of the woman. How does this happen? The womb has three layers. The outside layer, that is the external layer, which is like a covering, like a cellophane. Then the middle layer, which is the second layer, this is the muscle layer of the womb. And then the inner layer, which is the lining of the womb. It is this inner layer that embryos attach to. That is, it is where pregnancy takes place. So, during the cycle, in the first few days, depending on the cycle length, the egg the eggs are recruited. The dominant egg has formed, and while they are doing this, the eggs in the ovaries, these eggs they produce a hormone called estrogen. The estrogen now ensures that the lining of the womb, that is the inner lining of the womb, is thickened in such a way that embryos can attach to it. If it is too thin, it will be difficult for attachment to be effective. Again, if it is too thick, it is also going to be difficult. As doctors, we say that when a woman begins the cycle, the layer, that is the endometrium, that is the inner layer called the endometrium, should not be more than 5 millimeters. And as it grows, because of the stimulation by estrogen, by the time the woman ovulates, that is, you release the eggs at about the mid-cycle, then the thickness should not be more than 14 millimeters, which means that it should not be too thick and it should not be too thin. If it is too thin, pregnancy will not take place. If it is too thick, pregnancy will also not take place. It's like everything must be balanced and precise. Now, so when, like I said, when anything goes wrong with any of these processes, then pregnancy does not take place. And then all the preparation that the body has made in terms of the womb accepting, especially during the second half. During the second half of the cycle, if we can divide the cycle into two, during the second half of the cycle, another hormone called, let me start by saying that once the egg is released from the ovary, the shell that the egg leaves behind becomes what we call the corpus luteum. And this is rightly called the corpus luteum of pregnancy. So in the first part, before ovulation takes place, the estrogen is the one that is playing the most dominant or key role. But after ovulation and the egg is released from the follicle, then the corpus luteum is formed. And the corpus luteum, the major purpose or the major hormone is progesterone. And progesterone is the one that now begins to prepare. In 5 days, it has about 5 days to prepare the lining of the womb or endometrium to accept the pregnancy that is coming in. So if it does not do so and pregnancy does not take place, the bed or the endometrium that has been prepared will break down. And once it breaks down, the blood, the tissues of the endometrium, the cells, both the white blood cells, the red blood cells, the tissues, the glands, all break down. And this is what comes out through the vagina at the end of the day as menstruation. So this is the way menstruation takes place. And I hope we understand that therefore all these things will need to take place, and they are precise, and they must be orderly. And like I said, by the time we begin to deal with problems of menstruation, we will understand why things can easily go wrong. Now, so from what I have said, how can we define a normal menstruation? We can talk about a normal menstruation in terms of the duration, in terms of the regularity, in terms of the fact that the quantity, and the fact that whether it is painful or painless. Now, the quantity, the average blood loss in a cycle is about 30 mils. That's about 2 tablespoonfuls. Now, but it varies from one woman to the other, and it could be from 30 to up to 180 mils, right? Now, the issue is that these 30 mils will represent the lower threshold of normal, while 180 mils will be like on the excessive side. But like I said, this depends on the woman. And when we begin to deal with the problems of menstruation, we will realize how easily things can go wrong. We as doctors, we say that anybody that bleeds, that loses more than 80 mils or thereabout, is at a risk of consequences or effects. That is to say that women that lose more than 80 mils are termed as having bled excessively. So, what about the duration? The duration of a normal menstruation should be between 2 days and 7 days. 2 days and 7 days. It should not be less than 2 days and must not be more than 7 days. That is to say, 2 days is the lower limit of normal, and 7 days the upper limit of normal. What about the regularity? For a normal menstruation should also come at predictable intervals. And like I said, when I was talking about cycle length, your cycle length must be fairly equal. When I say fairly equal, I mean that you should be able to say that, well, I expect my menses to come in the next few days, or this and that. That does not mean that if it does not come at the exact dates that you predicted, that it's a problem. But you must have a fair prediction of when your menses should happen. It becomes, when we say it is irregular, it means that you cannot predict it. It comes at times when you don't expect. So we should bear all those things in mind. And the other issue about a normal menstruation is that it should be painless. Well, I need to qualify the issue of pain here. Pain is a subjective symptom, and what is pain to you may be a mild discomfort to me. What is what is severe pain to a woman may be a mild pain to another woman. So this is very subjective, but by and large, normal menstruations should not be visited with severe pain to the point that it becomes a problem for the woman. Excuse me. So now we can then define, having talked about all those things, we can define what a normal menses should be. A normal menses is one that is moderate in quantity, comes at predictable interval, excuse me, comes at predictable interval, lasts for normal a normal duration, that is between 2 to 7 days, and it is painless. Let me go through that again. It is normal in quantity, that is about 30 mils of blood loss. It is regular in appearance, in incidence, that is frequency, that is you can roughly predict when it should come. It is in terms of duration, the flow is between 2 to 7 days, and then it is more or less painless. Now, this is a normal menstruation. Now, it is very important for women and ladies to be able to prepare for their menstruations or their approaching periods. For example, if you are going to work, you go to the office, and you know that you are around, your period is around the corner, you probably will put 1 or 2 things that will make your menses more comfortable in your ladies' bag. And so it is very important for you to be able to predict it. So let me talk about why we are still on menstruation before we go to the signs. The first menstruation that a lady experiences at puberty is called menarche. That is, menarche is the first menstruation that a young girl does or experiences when she attains puberty. Now, the world over, for reasons that are not too clear to doctors and scientists, the trend now is that the age at which young ladies attain or young girls attain puberty is reducing. Normally, the age at which young girls attain or experience their first menstruation is reducing, just like the age of puberty. Normally, the average is, or the range is between 12 and 14 years. But now this age is, this age bracket is reducing with time. That is, people attain their first menstruation before earlier than when you compare with ladies in the previous decades. And as at present, the average age at menarche, that is first experience of menstruation, is about 12 years and 8 months, and it is falling. Why is it falling? We don't know. Unfortunately, doctors don't know why this is falling. But one thing we know is that the world is changing, things are changing. We've realized that things, just like you talked about the climate change, the world is changing and the environment is changing. We think that, okay, for some people, you can find this trend in the same family, that is, ladies or girls in the same family experience the first menstruation or menarche, earlier than the other girls in the general community. Some say that it is because of lifestyles, because it's been noticed that people who are fat and obese in children, that is, obese or fat girls, get mature faster and they attain menarche faster. This is the era of opulence, where many people have more than enough to eat and to drink, and therefore opulence, some doctors have queried the increasing opulence. Some have queried the issue of diet, that okay, fine, people now eat a lot of calories, that is sugar, a lot of fat, a lot of dairy foods. And those who believe this, these doctors that believe in this, they believe that the sugar and those food items may upstage the hormonal balance that bring about puberty and then result in early menstruation. Also, we know that people who live in low altitudes in some countries, not in Nigeria though, do attain menarche faster than the others. Urban living, people in urban cities, or living in urban areas like Lagos and environs are more likely to attain menarche or their first menstruation earlier than those that live in the villages. So these are some of the issues we need to clarify, because before we discuss the problems that may show up with menstruations. Like I said, we have laid the ground for our discussions, but let us go to the signs that ladies should watch out for when that may show that the menstruation is approaching. Now, I need to say that some do not feel any signs or symptoms. Some are lucky, they don't have any signs and symptoms. So there's no prompting, the period just comes like that, and it is just normal and just like that. But I want to say, I must say that the signs and symptoms that people complain of when they menstruate, they constitute a group of complaints that are more or less individualized, and they are more common with very young girls girls that have just started menstruating, that is maybe in their first few menstruations. And these signs tend to get better. They tend to have easier and less painful, less eventful menstruations as they get more and more mature, or more so as they begin to make their families. So we, as doctors, we say this group, we categorize them as just syndromes. And like I said in my previous talks when we were discussing puberty, syndromes are not necessarily diseases. They are not necessarily problems. But then when they incapacitate the lady, or they in such a way that she cannot carry out certain functions, then they become issues. Now, most of these signs and symptoms happen before maybe a few days, 3 to 5 days before the menses or the menses starts, before you see before the flow. So you start to have these symptoms, and once the menstruation starts, these signs and symptoms or complaints tend to disappear, and that is why we say they are premenstrual. That is, these are complaints that show up before your menses. In medical parlance, we say they are premenstrual syndromes. So what are these complaints? Well, first, I must say that, like I said, this may not happen to you, but it happens to many other people, and they are not that you are sick. It's only that they herald your menstruation. The complaints include things like headache. Some people experience headache before a few days before their menstruation. Some have poor concentration. They just believe they are not concentrating. They are confused, a little bit confused. Some have pimples. Pimples begin to appear without any reason. Some begin to eat more, but some eat less. Some experience bloating. Bloating means that you just feel that you gaining weight. You have gained some weight, and without any cause. It's not as if you are eating more than normal. And then aside from weight gain, the breast becomes more robust, can be more tender, especially tender and tense. And then the nipples can become more tender and more sensitive. And then you can experience low abdominal pain. Some become irritable. That is, they are just anxious, they are hostile, they are less tolerable, they have less tolerance for other people and other situations. At the extremes, you have mood swing. People experience the mood of the women. Some women swing from happiness to dullness and unhappiness. And some will behave as if they are depressed. You know, when somebody is depressed, it's very quiet, it's not happy, and it appears as if things are not going well. So, but at the extremes, you even find some people just crying. They weep. They just weep, and you ask them, "Why are you weeping?" They don't have any. They cannot explain why they're weeping. These are extremes of this. Type of complaints. And so mood swing and depression, anxiety, and some will have like I said, they have bloated. They experience bloating. Some experience change in bowel habits, especially constipation. Some we have feelings as if they want to vomit, and some may actually vomit and all that. Some become very clumsy in their dealings. You ask them, why are you doing this? They can't really explain. They find out that things they can achieve or do seamlessly becomes very difficult and clumsy. All this will happen 3 to 5 days before the menses appear. And once the menses appear, they seem to disappear within the menses. Before the menses, the flow stops. So that is why we say they are pre-menses, that is, or they are pre-menstrual, or they are before. They are symptoms or complaints that regularly occur before their normal menstruations. I should maybe you would ask me, why do these things take place? The truth is that we as doctors don't know. We don't know why they take place. But there are suggestions that, well, because the menstrual problem is, menstruation is about hormonal governance and regulation. So if there is anything, there are some things that could interfere with the functions of these hormones and then cause such derangements. And some people have said, okay, so meat can do so, sugar can do so, dairy meals like ice cream and all that can do so, and all that. And but we are just guessing. And the fact is that we don't know exactly. So if you believe, even some suggest that if you lack some vitamins, like pyridoxine or vitamin B6, you can experience this. And so when we prescribe remedies for this type of complaints, when you go to a doctor and say, doctor, I have these complaints, when each time my menses wants to appear, I will feel I lose concentration, I'm less tolerant to people, I feel unhappy, I feel pain in my lower abdomen, and all that. The doctor will then look at the symptoms or your complaints and try his very best to prescribe or to manage. But like I said, because we don't know why this is so there is no best treatment for this. Therefore, we have people, if you complain of pain, we can give simple analgesic can help you. If, for example, you dull pain in the lower abdomen or around your waist, you can use antispasmodics, and these are drugs that relieve spasm and all that. Because of the congestion and like in the breast is very tight, it's very heavy, nipples very sensitive. Some doctors will prescribe drugs that will make relieve the breast of water so that it is less painful. Some, like I said, give vitamins, because in the belief that vitamin is one of the causes of these type of problems that appear before menses. Some people, especially for the young ones, in the first few menses, can benefit from oral contraceptives or family planning pills. Other things that people have talked about in alleviating this type of complaints include exercise. That exercise also is very good in the time running up to your period. Like I said, there are so many prescriptions depending on what the doctor believes in. Some say if you reduce your caffeine or coffee and all that, you may probably have reduction in these symptoms. There is some people talk about primrose and all kinds of things. What I want to say here is that whatever works for you, you should stick to it, but it doesn't mean that it will work for your friends. So do not engage in self-medication and all that. Let me just try and so this is laying the foundation for our discussion of menstruation, and because when you understand what I've just said, you will then understand when we come to challenges in menstruation, like irregular menstruation, like pain during menstruation, like scanty menstruation, heavy bleeding, and so on and so forth. But as a teaser, I'd like to pose the questions or answer some questions that people ask me. Doctor, if I menstruate twice in a month, is it normal? Yes, it may be normal if one, like I said the cycle length is between 22 and 35 days. Sometimes 40 days may be normal for you. If it comes regularly and it is the flow is moderate and there is no it's moderate in flow, it comes regularly, then it may be normal. All right. Now, if you menstruate twice in a month, let us say you menstruate 1st of October and then you menstruate 25th of October, but it is regular, it falls within your cycle length, then it is normal for you. It does not have to happen as striding 2 months. It doesn't need to fall on September and October to be normal. The things that you should bear in mind is the cycle length. Can I count 22 days? Is the flow normal? Does the duration, is it normal? Is it painless and all that? Of course, realize that mild discomfort and all that may not be an issue. All right. So what I'm trying to say, therefore, is you knowing what is normal for you and not necessarily what is normal for your friend. If some people would ask me, therefore, if I menstruate for 1 day, is this normal? From what I have just said, I told you that the duration should be at least, it should last for 2 days, but not more than 7 days. So 1 day is too short for a normal menstruation. Therefore, if you menstruate for just 1 day, then it will be regarded as abnormal, and then you may have some other challenges which we will discuss in subsequent topics. All right. If you menstruate for 10 days, therefore, some people do 10 days, 20 days, some, it doesn't stop at all. Is it normal? It is not normal, because that means that you cannot even predict when it is going to stop. And all these problems are associated with issues that border on, for example, you cannot predict when you are ovulating. If you cannot predict that, you cannot say when is your best chance of getting pregnant. And if you are the one that wants to do family planning, you cannot say when is the best chance of abstaining from sexual intercourse. So these are some of the things that we will discuss at this point. Like I said, we have broken this topic into parts. This is the first part. The second part, next time I'm going to discuss irregular menstruation and irregular menstruation and painful menstruation. And then we discuss scanty menstruation, we discuss heavy menstruation, and then lastly we'll discuss no menstruation, which is called amenorrhea. I'll take some few questions, but the questions we are going to take will be those that are related to what I have said, so that we are able to clarify shed further light on some of these issues. Please, sir, what causes severe abdominal than other days of pain at all? It is, what's it?
Is it normal?
Is it normal or abnormal? So severe abdominal pain during menses. Like I said, we are still going to discuss all this, but then the short answer is that severe abdominal pain is not normal. But if it is part of what I have discussed, if it comes before your menstruation, then it may be a part of your complaints, which is regular. Let me say this: anytime the complaint is so severe that it leads to incapacitation, that is, it disturbs you, for example, from going to work or from cooking and all that, then it is a different thing entirely. It is not part of the syndrome that we just discussed. Rather, it is called a dysphoric disorder. It becomes a disease. It's a disorder of such menstruation, which means that all the things I've said, if, for example, you have headache, you have confusion, you have loss of concentration or constipation, but you can still go to work and perform your normal duties. That's okay. But the moment it disturbs you, it disallows you from doing all those things, then it becomes a disorder and needs attention. So this severe abdominal pain is not normal. But like I said, we will discuss this when we start to treat pain during menstruation. Next. My daughter of 10 years has been complaining of pain in her lower abdomen. Is this sign of menses? The pain goes and comes. Well, at this point, you need to watch your daughter very carefully. When we discussed puberty, we talked about some characteristics or some problems. One of them is that menstruations are likely to be more irregular when a lady just attains puberty. Now, there are certain things which we'll be discussing, later. If the pain that the girl is experiencing comes every month, you need to take the girl to the doctor, because there are some abnormalities of the genital tract that may be an issue here. When it is possible that your girl is menstruating and the blood may not flow out because of an obstruction, and the obstruction may be due to, say, what we call imperforate hymen. The hymen is the cover. The cover at the entrance to the vagina. All right, it has a little hole there. But if it is not perforated at all, or there is an abnormality of the vagina, where the vagina, instead of having a thoroughfare from the neck of the womb to the outside, the vagina is blocked. Okay, your daughter may be menstruating, but the menstrual blood may not be able to flow out. What it then means is that your daughter will menstruate every month, and then the blood will accumulate inside the genital tract in the vagina, and if the vagina is filled up, it will go to the womb. If the womb is filled up, it goes to the tubes and all that. So there may be a mass, therefore, in the lower abdomen. So therefore, the fact you have to take the girl to the doctor, who would examine whether this is the case. In such cases, this lower abdominal pain will be felt by the child every month, and that is a pointer to the fact that the girl is menstruating, but the blood may not be coming out. Of course, like I said, the girl may be menstruating, and because it's very young, like I said, all these things, the problems that we talked about are commoner in young girls when they have just started menstruation. But I would advise that you take your girl to see the doctor, so we make the diagnosis and take measures to correct the problem. Next question. Sir, is menstrual what's this? The menstrual clots normal or abnormal? See, the womb, thank you for this very good question. The womb has the capacity, the way God has created the woman is, they are so much endowed that they are able to, their body form and functions are superb. Normally, during menstruation, the efflux, that is the menstrual flow, should not clot, because the womb itself has a capacity to prevent clotting. But clotting, when the blood flow is so much, the womb may not be able to cope in the sense of preventing clot. That is, the capacity of the womb to prevent clotting will be overwhelmed, and then clots begin to appear in the menstruum, that is the menstrual blood. It's an abnormal thing for clots to appear in the menstrual blood, and it shows that the bleeding is heavy, and that means that you should see the doctor for correction. Hello. What is the cause of breast pain before same period? During the talk, we mentioned that in the period leading to menstruation, about 3 to 5 days before menstruation, that one of the things that may happen that may show that your menses is around the corner is congestion in the breast pain, increased sensation of the nipple, and all that. So this is one of the components of the syndrome. And like I said, once the menses starts, this should reduce. But if it is very severe or a problem, you need to see a doctor so that they can give you the remedy, But many people do experience this. So there are some months my periods don't come. Is there any problem with this? Now, what I can say here is that if you say there are some months that they don't come, you need to tell me whether they come regularly at predictable intervals. Like I said, your menses does not need to happen in September, October, November, and so on. It could happen twice in a month. It could happen in between 2 months. But the important thing is that the period in between your last menses and your next menses should be fairly regular. And to say that the average length of a cycle that many women experience is about 28 days. So if you can count 22 days, and your period is not less than 22 days, and it's not more than 35 days, whether it is absent in a certain month or not, does not matter. What matters is the time in between the last one and the next one. What could be the cause of vaginal pain during menstruation? There are so many causes of pain during menstruation. But like I said, we are still going to cover this in our subsequent lectures. So because you need information so that you can understand the answer to this problem. Vomiting on first day of menstruation, is it normal? Like I told you, it is part of the complaints that women experience. Like I said, some people they feel like vomiting. Some actually do vomit. Some have headache. Some have constipation and all that. This should stop. This will happen normally between 3 to 5 days before the menses, but they should stop as soon as they should get better as soon as the menses start and stop completely before the end of the menstrual flow. Can continuous flow be treated? Yes, but we will treat the remedies of heavy continuous flow in our subsequent topics when we treat heavy menstruation. Is it normal for a teenager to menstruate for 7 days? If you listen to the lecture, I said the duration should be between 2 and 7 days. So if a teenager menstruates for 7 days and it is regular and at 7 days, then it may be normal for her. But remember that I said that most of the complaints that we talked about are commoner in teenagers when they are just starting menstruation, and they should get better with age. As they grow older, the complaints tend to be less and less, and especially when they begin to have children. All right. May I say that in terms of quantity of flow, perhaps what you would understand is, like I said, I talked about 2 tablespoons. Tablespoonfuls, and at the extreme you have about 12 tablespoonfuls, which is too much. But the normal language, I think that you should understand, is the issue of parts. Normally, we say it should be between 3 to 5. When you use more than 5 parts, then it's probably suspicious that you may be having heavy bleeding. So 3 to 5 and for 2 to 7 days. Right? These are figures that you should carry about and always remember. Question: my menses comes regularly at 28 days and I am not getting pregnant. I am 45. Is there hope of getting pregnant? I think we will treat this type of question when we talk about irregular menstruation and their causes. What is responsible for menstrual flow in early pregnancy without the fetus being affected? Well, people can bleed in pregnancy, and there are so many reasons why a woman may bleed in pregnancy. When we get to bleeding, we will talk about this. Incidentally, pregnancy is one of the causes of